Omang Banjuare lives in Calabar. Married with a kid and unemployed, she typifies the everyday struggle of the average Nigerian. She had her child in this primary health center she is visiting today. 2 months after the birth of her bundle of joy, Omang and her young husband, who is a salesman in a cooking gas shop, sunk into debt. Their joy turned to pain as their child took ill months after her birth, and they had to borrow from neighbors and money lenders to pay for their daughter's hospital bill.
The money we spent there was about 45,000 for the boy. One of our neighbors there borrowed us money and his friend there. So that's how we managed to pay the bill.
Everywhere you go in Nigeria, there are numerous stories of the suffering and pains poor Nigerians go through to get access to quality and affordable health care. When health care is available, it is of poor quality and expensive, leaving a gaping hole in the pockets of patients and their relatives. In 2005, Nigeria established the National Health Insurance Scheme with the aim of fast-tracking the effort towards universal health coverage. Regrettably, 13 years after, it has been only able to provide about 3% coverage in the country, mainly covering federal and public sector workers and their families. The Nigerian healthcare sector over the years has remained a sad story with scary statistics that paint a bleak picture. To confront this affordable and quality healthcare challenge, Governor Ben Ayade of Cross River State in South Nigeria instituted the Cross River State Health Insurance Scheme, later christened Ayade Care, by the Cross River State House of Assembly.
If you have a clear understanding of the demographics and the financial income of our people, the people of Cross River State, it's obvious that until I do a program that caters to those who can't earn income, who don't earn income, a lot of people will be outside the insurance cover. We've put in both the legislative and material structures to ensure that this program takes up unhindered.
Part of actualizing the governor's objective was the multi-sectoral approach employed by the government in collaboration with key stakeholders, the synergy between the executive and the legislature, and ability to assemble a crack team of professionals to give life to the insurance scheme.
Commitment of His Excellency the Governor towards the success and takeoff of the health insurance scheme is monumental. In this year's budget, the total state budget is 1.3 trillion. And I can comfortably tell you that the state health insurance scheme has a budget of about 12.1 billion naira dedicated to the takeoff and successful implementation. Aside that, 1% of the state's consolidated revenue fund is set aside to support the health insurance scheme.
We have mapped out 196 primary health care centers, one in each ward, and we have been able to put our focus there, focusing on the manpower. By that, I mean we've been able to hire more hands and equally pool staff into those facilities to make them 100% functional.
We have hospitals in our local governments, but not all local governments have general hospitals in the state. What I mean is not all local governments have a secondary facility. So we are going into the local governments that don't have a secondary facility to make sure that we have a secondary health facility where there'll be referral from the primary health centers to the secondary facility. So right now, construction is ongoing. Renovation of the old facilities is also ongoing. Facilities are already on ground. And then construction of these Ayade Care referral hospitals where there are none.
We know that all is not well in the health sector. Our people are even dying from preventable diseases. We know the state of our primary healthcare system, the secondary healthcare system, even tertiary. And we know that funding had been a great challenge. So as legislators, we decided that, look, we need to embrace a better way of funding the healthcare. And we had no option than to adopt the state health insurance program.
Through massive enlightenment and education, the government secured the buy-in of workers and the general population whose support is critical for the survival of the health insurance scheme.
We have put together a media package, a sensitization package. We've started on some. We are still doing others. We're also doing some work to get to the grassroots. And that means we are engaging our old system of town crying so that people are informed. Series of town hall meetings have been held and are still being held. Meetings with the unions, with the labor force have been held, and more of these meetings are to be held.
You don't have to have hypertension what to do when you are sick. For instance, if everything remains equal and the policy implemented, simple. You just walk from, anytime you are sick, you walk from your house to the nearest health center or the primary health center, whichever we're going to use, and you have yourself treated, which means you already pay the price ahead.
Capacity building was a key component of preparations for the takeoff of the scheme, and a lot of support came from partners like United States Agency for International Development, Health, Finance and Governance Project. All these efforts paid off on May 28, 2018, when the governor of Cross River State, Professor Ben Ayade, formally inaugurated the insurance scheme in the state capital, making Cross River State the first in the country to take a concrete step towards universal health coverage.
From today, you have a full insurance cover. Please, let us celebrate Cross River for being the first